So please, our panelists, you're welcome. Come and sit on the seat. Yes, thank you. And our moderator for this afternoon session is Dr. Das. Yes. So we are going to have the session, the panel session, moderated by Dr. Das. Secretary for Health, Dr. Osborne Liko, will chair the session. I'm going to introduce him, and then he will make some opening remarks. And after that, we're going to hear a keynote address that will be delivered by Governor Gary Juffa. So thank you. Dr. Liko advises the Minister for Health on policy, legislation, and operational matters, provides overarching policy, legislative, and standard support to the 26 health sectors, including 21 of which are PHAs, Provincial Health Authorities. Dr. Liko is also the chair of the National Health Board, Special Procurement Committee, the Pharmacy Board, and coordinates development partners that support the health sector in Papua New Guinea. So I'd like to welcome Secretary Liko to make some opening remarks, and then we will pass it over to Dr. Das to moderate this afternoon's discussion. Thank you.
Thank you very much, MC. Thank you, everybody. It's been a great day. And again, we'll go through for tonight and then for tomorrow until we end our sessions, the summit for today and tomorrow. So it gives me a great pleasure. And of course, to have our invite to all of you to come from abroad, and of course, even from our PHAs. And also, I'd like to take this opportunity to welcome our Governor for Oro, Gary Juffa. Thank you very much for accepting our invite to be here as well. Yeah. This is all about the collaborations at all levels, from the national level to the provincial level, and bottom-up collaborations as we have had this morning and until up to now. And basically that means that, as we heard from the speakers this morning and today, and we ended with our leaders' collaborations and discussions on each of our neighboring countries, how to collaborate, how to support in having our goals of eliminating malaria in our region and in our country. So the bottom-up approach, and as we've had, I think, great discussions from our Melanesian countries, Solomon Islands, Vanuatu, and even Indonesia, on that collaborations and bottom-up approach at all levels is very critical here. So on this note, for this session is very important. From the national level, we do a national health plan and all our policy strategies. But as we cascade to the provincial levels, and from the provincial to districts and right down to our community, our implementers here from the provincial, our governors of our 21 PHAs and provinces, including Autonomous Region of Bougainville, and our chairman of each of our PHAs, 21 PHAs, and the CEOs, and cascading from those higher level administrative levels to each of the directors, and in public health, of course, directors of public health, even to our district level, to the district's health administration, right down to the communities. It's very important that the national budget and the national health plan that we, from the national level, do and have that cascaded to our PHAs, right to our community level, how we actually implement those are very critical here. And as we talk about malaria, as we heard from our great speakers and our leaders, our provincial and our PHAs, the leaders, are key in terms of the delivery of those key objectives and priorities. And in malaria, I think we have our CEOs here. We have total of the 15 provinces and the PHC which is a hotspot. Of course, I would love to have everybody up on the stage, but of course, given the time and situations we have 6 of our CEOs from the 15 hotspot PHCs, and also privileged to have Governor Juffa from Oro to be here to represent the rest of the governors of our 15 PHCs or hotspot provinces. And we've also had from this morning and from the data that we know and the statistics, PNG, 94% of our outpatients and hospital mobilities, and it's not only for Western Pacific, but also on the global, the situations of the malaria that we have. And of that, we've had the highest mortality in terms of any infectious disease is malaria, 250 to 300 per year. So those are the real situations we have. So this opportunity we have is now through our PHAs and with our National Health Plan, with the budget support we have, how do we implement this? I think the experience we'll get from our CEOs and some of the chairman of our PHAs who are here also will tell if time allows, we allow those chairmen of our PHAs also to share their experiences and how we want to achieve our goals on eliminations of malaria by 2020 as we prescribe in our National Health Plan. Thank you. Up on the panel we have the CEO of Morobe PHA, Dr. Binga, and CEO of Milne PHA, we have Dr. Perista Mamadi, our moderator, Dr. Das, and CEO of Oro PHA, Mr. Stanley, and CEO of Madang PHA, Mr. Waima, and our CEO of Manus PHA, Mr. Francis Possi. Let's give them a big round of applause. Yeah. So I'll stop here, and I'll hand over to our moderator, Dr. Das, and Dr. Das few remarks, and we can have our CEOs to come onto the panel in the discussions that we have. Thank you.
I don't think, okay. It would be hard for me to stop talking because I have to say that, sitting in this panel, and I jumped at the chance to get to moderate it, and I don't exaggerate to say that so much of what I know about public health and delivery has come from CEOs of provincial health authorities or provinces in Papua New Guinea. And there are some that are no more and some that are still here, unfortunately not here directly, but I wanted to say that I think in some ways with all the leaders that we had so far, it's incredible that we have this array of leaders as well, because this is so much of where the real execution will have to happen. So 3 questions that we're going to go through, and we had a very good discussion yesterday in the evening, which made me excited about the fact that we were going to do this panel. So the first question is, for you all as CEOs, in terms of executing on this task of reducing the burden of malaria, what are some of the key challenges that you're facing? And I know that many of these may be the same, so if you want to just pick one, and then we can always come back to you if it hasn't come up again. Dr. Binga, do you want to go first? Yeah, thank you.
Thank you, Dr. Das. I think for us from the PHA side, when we say malaria as a CEO, I don't just see malaria as a single disease. We see it in the context of all the other communicable diseases as well. That's including TB, HIV, and everything else. So when we talk about malaria, we have to be very mindful of the other diseases as well. So when we approach it as holistically as best as we can. And so meaning that whatever resources that we have for malaria, other diseases can also piggyback on to carry out their programs as well. And likewise for TB. If there's a TB resource that is coming through Global Fund or other means, we must also use that avenue also to piggyback and carry out other programs Let me just perhaps, as an opening remarks, just make this a second point I want to also make, and perhaps also bring to our attention, is also the way we spend money globally in terms of healthcare. You find that about 80% or 70% of our money that are spent is to treat, we spend to treat sick people, which constitute about 20% or perhaps less than of our population. But we spend 80% of our budget on those people. It's about high time now that we changed it around and spend about 80% of our budget on 80% of our people who are well people. We need to start shifting our focus in that direction. So those are one or two points that I want to make, and that's where Morobe PHA, that's where we stand, that's how we would like to see ourselves. In terms of partnerships, as collaborations, and later I'll probably touch on some of our challenges that you've mentioned. I think we see ourselves as not a primary health caregivers, and it is correctly echoed. We see the patient himself as the first primary source of health caregiver, him or herself, unless they are disabled or they are young. And then the family comes into it and everybody else comes. We play the PHA and the health system. We see in Morobe as the third caregivers to healthcare in the province. And everybody else, partners coming to support it. And from the malaria space, I think malaria, I was as a clinician back in 2013, 14. We realized after the rollout of the mosquito nets in this country, malaria dropped out. I was working in Mount Hagen. Malaria dropped out as a top 10 cause of admissions for severe malaria into the wards. It came out. And after that, moving down to lay, and then now we are seeing that it's slowly reemerging again, and we're seeing those people now presenting again. And perhaps one of the reasons is, I think, from the malaria programs itself, is the bed nets that has been rolled out. I think we are not consistent in terms of getting those bed nets out on time, and also not only that, but also the quality of the nets, how long, I think those issues were also raised. I think, let me just put that on record as first thing on for us for the challenge of malaria. In recent years, the malaria program was also, apart from changing its treatment protocols, we also realized that the diagnostic tool became also available to us on the clinical space. And so clinicians are now able to diagnose using RDT, rapid test diagnosis, which we were treating symptomatically in the past. Now that tool is available, that means the diagnoses are made earlier, then we must have the resources in terms of medicines available to treat malaria when a diagnosis is made. And if supplies are not reaching us on time, those are some of the challenges we have in the provinces. So I'll stop here from the drug space. Others can mention the others. I'll stop here. Thank you.
Thank you, Dr. Binga. And one thing I should have said at the outset, just because there are some who may not be as familiar with Papua New Guinea, I was forgetting that. Just the sheer diversity that's sitting on this stage, and the geographic complexity and the terrain complexity. And Dr. Mamadi, if I'm not mistaken, Milne Bay is over 90% sea. But if you could speak to some of the challenges in your province, in any particular areas you want to highlight, feel free.
Thank you. Good afternoon, everyone. Firstly, I want to acknowledge particularly our Ministers of Health, our international guests that are here. Please take a time out to see Port Moresby. But if you want to enjoy Papua New Guinea, Port Moresby is not Papua New Guinea. You come to Milne Bay where you will experience Papua New Guinea. Milne Bay is a maritime province. You'll fit 5 provinces of the Highlands provinces into the seas of Milne Bay. That's how big the sea mass is. So most of Milne Bay is sea, but our mountains are as rugged as the ones experienced in the Highlands. And Milne Bay also has challenges in malaria. But you find that when it comes to challenges in malaria, we blame the geography. And we think that the geography is the reason why we are not able to achieve the indicators or the malaria indicator. But I think the key challenges is for us in Papua New Guinea is the systems that we need to strengthen. it is important that we look at how we are managing this malaria in Papua New Guinea and the resources that we channel to address malaria. So probably I can say that we should look at systems strengthening to address malaria. And one of those system strengthening is financing of malaria program. The government has indicators. I'll go back to the time when our World Vision was living in Milne on the program of TB. And when they left, TB was kind of like suspended. And only when I went to go back to the policy and only to find that malaria or TB was funded by our development partners. So it is important that we go back to that and understand the indicators, health indicators in Papua New Guinea. Is it funded by the government or is it funded by the development partners? And if it's funded by the government, we need to strengthen that. If it's funded by the development partners, why is it that it's not strengthened through the financing pathway? So one of the things that we need to do in Papua New Guinea is that we must go back to our financing system. The money for malaria, is it going direct to malaria? If it is not, we must put money in malaria. TB, we must put money in TB. So that we can follow the money all the way to the recipients, all the way to those that we want to serve in the rural community. So systems strengthening is very, very important for us in Papua New Guinea. So that's vertical pathway. What about the horizontal pathway? The provinces are managed through the organic law, provincial and local level government organic law. So any activity that we want to roll out from the national level down to the provinces, we must integrate that into the provincial and local level government service delivery framework. Our leaders at the provincial level, at the district level, at the local level government level, and at the ward level where people live, they need to know what we are doing. If they don't know what we are doing, it does not matter how much resource we try to pour into achieving the malaria indicator, we will still struggle. And I like the discussion this morning on community engagement. It's very, very important that the community are engaged. The government system is already there, but we need to strengthen that. And it is important that for us, and I like the National Health Plan now, where we have 6 levels of service, 6 health levels, and the second and the first are at the ward level. And it is important that we strengthen that so that we can be able to manage malaria at that level together with the people by understanding their health needs, understanding their need in malaria, and how can we plan that together. So they should have more input, and I agree that there must be more community engagement. And together we can be able to address malaria at that level. Funding, in my view, for Papua New Guinea is not really the issue. The issue is managing the money available. In my view, that is the issue. And if we can be able to direct the resources appropriately, it does not matter how much level the money is or how much more the money is, I think we can achieve a lot of things. I think I'll leave it there for a while. Thank you.
Dr. Mamadi, just a quick point of clarification just to understand. When you say the money for those who may not be familiar with the system in Papua New Guinea, when you say the money for TB should go to TB, the money for malaria should go to malaria, what is the way that it's working now? Can you just briefly explain?
Now we have the program is called disease control. And the disease control, malaria, TB, HIV, comes under disease control. And so the money is given to disease control, and disease control then now try to manage that money to address TB, malaria, HIV. But what should happen is that money should follow the function. So money for HIV must go direct to HIV. Money for TB must go to TB. Money for malaria must go to malaria. And the administrative component of managing these programs can go to disease control, where disease control will then oversee HIV, TB, malaria. For now, we are discussing malaria, so whatever the money that is made available through the government system, through the chart of accounts, at the integrated finance management system, it must go direct to malaria. So when we do that, then the government will be able to follow the money all the way to the recipient. As it is now, it's not quite clear. So when we talk about program budgeting, facility program budgeting as per the National Health Plan, we are still quite far from that. So it is important that when we talk about systems strengthening, we must go back to IFMS and look at the chart of accounts in the IFMS. Does the money go direct to malaria? If the money is not going to direct, because malaria is an indicator, government health indicator. Disease control is not the government health indicator. So that's why it is important that we address the government health indicator. And the government has health indicators in Vision 2050, Papua New Guinea Strategic Development Plan 2010 to 2030, MTDP 4, National Health Plan 21 to 2030, and then it goes down. So it is important that we put the money, we address the health indicators. The money must go direct to the health indicators. So the money must follow the function.
Thank you.
Thank you.
Thank you for that clarification. Dr. Titus, in terms of Oro, do you have any particular comments on challenges, and perhaps also with specific reference to the systems view on what some of the challenges are? Yeah.
Good afternoon, all. Actually, looking at eliminating malaria by 2030 is quite a big challenge for every one of us, including Papua New Guinea. And looking at Oro itself, I think the major challenge for Oro is really the health system itself. We have malaria as a burden of disease, and I believe there are other burden of diseases that we have as well. And without a very strong health system, it is very difficult for us to really address the current situation we are faced with malaria. By the health system, I allude to the funding as one, as my colleague has mentioned earlier. We need sufficient funding to be able to carry out our programs effectively. The malaria test kits have to get to where it matters, and that's at the health facilities. How does it have to get there? And I believe with PNG, we are a very challenging country in terms of our geography. It has to cross rivers, it has to go up the mountains, it has to cross oceans, and you can imagine the challenges that we are faced with. And Oro has the sea to contend with, rivers to cross, hills to climb, so it's quite a very, very challenging thing to do, especially when we trying to address malaria. With the current drug situation, it's not helping at all. So I believe we can strengthen financing, if we can strengthen the medical supply system, if we can be able to deal with the reporting component of it, make sure we have information that's available so that we can adequately plan and execute the malaria program, as well as having good leadership and governance as well. I think in decision making, we need to make good decisions where we are able to put the money where it matters the most. And that's where the leadership and governance support is really required. We in the health space talk a lot about the technicalities of things and the strategies that we can employ to really address malaria effectively, but I believe we need to also strengthen the component where the political will is so important. And that is also supported with the enabling environment, where we have to address the issue of roads and bridges, communication, transportation, and all the environment that's necessary for us to effectively carry out the not only the TB program, but the health program, if you look at it that way. And of course, on top of that, we have the health system, which I just alluded to.
Thank you. Madang, your province.
Thank you, Dr. Tas, and welcome to all our international delegates coming. It's a pleasure to see you all participating this morning. Also to our friends coming from the provinces, and of course the government of Papua New Guinea, as well as under the leadership of our minister and the secretary, for hosting this very important forum. Yes, of course, in Madang we have a lot of significant challenges that actually are similar to what my colleague CEOs has already said and discussed. We have challenges in terms of financing, where I think the program coming to the subject of discussion, elimination of malaria, it's a very, very big mammoth task for us at the PHL level. And so, but it will only happen if only resourcing is available to those implementers, those PHAs in the country, where we are the ones vested with those responsibility to make sure this program is happening in the province, which we want to see. It must be the program is enhanced. Now, coming back to the challenges, malaria program in our current financing arrangement, it comes to the disease control, and disease control covers a lot of other smaller programs as well. So it is something that we want to see in Madang from our perspective is in order for us to really eliminate malaria, is to give it prominence. Make it a key or core economic item under our budgetary arrangement. That's something that we want to see, so that we can achieve the dream of elimination of malaria in 10 years or 5 years' time. There are other compounding challenges and issues as well. In order for us to achieve that, we have human resource challenges. With the minimal staffing that we have in the facilities, the challenges that with the staff, the aging workforce that we have, those are some of the things that we need to really improve on to make sure this program is given its prominence. So accessibility is another one. For us in Madang, it's very, very challenging because we have 2 or 3 districts where accessibility is a big challenge. So we reach those districts through chopper, sometimes through boat if the sea is okay with us. Otherwise, we have to stay on and wait for some time to make sure that the environment is good for us to travel. So accessibility is one thing that will enable our staff to have reach to those unreached, the people that matters most in the far remote districts of the province. So Madang, for example, those of you interested in Madang, it says border with 6 provinces, and it's very, very challenging. Sometimes you have to travel some good, maybe a day, 2, to start providing services. So our staff has the accessibility is a very important one, which I think reaching a facility or getting out a program in a particular facility or a district is a bit sort of a challenge, which I think the government should be looking at. Connecting those services so that we can reach to provide those services that the people deserves. Thank you.
Thank you. And Mr. Posey, you're in the position of having to be at the end of this, but from the perspective of Manus, is there anything else that you can share with us?
Thank you. Let me begin with some of the challenges we have in Manus. First of all, let me start with coordination. coordination between RAM, coordination between RAM, NDOH, and the Provincial Health Authority itself. So that's our first challenge that I'd like to share with everybody. What we are seeing is that if RAM based in Port Moresby with National Department of Health, there's a representative in the province for RAM. And that representative in the province is normally appointed by RAM itself at NDOH. So when the officer from the RAM leaves Port Moresby to Manus, he arrives or she arrives at the time that they've indicated to us. Sometimes they just come into the province, and when they come into the province, they go straight into the programs. They get on the boat and they go to the outer islands or the inland areas to distribute bed nets particularly. That's the main function the representative in the province does. He or she goes and distribute the bed nets. And other programs they go and do training or advocacy and awareness to the province. But the coordination is like this. Sometimes the officer from RAM goes to the province and he or she has gone directly to the islands or the places where they go and distribute nets without coordination from us or even the NDOH, the coordination between NDOH, RAM representative in the province and the national representative in the PH. So that's one of our challenges, and we'd like to strengthen coordination between the way we do things in the province, because the malaria rep is normally a representative by the rep itself, coordinated by NDOH. So that's one of our challenges, and we'd like to strengthen coordination between those of us who deal with malaria in the province. So that's our first challenge. The other challenges we have includes the health centers and the APOs. Most of our facilities infrastructure is not to this position to assist the RAM officers or assist properly, appropriately the program, malaria program, because of the infrastructure in the particularly the local level government, the village settings. So that's another challenge we have in relation to infrastructure. The other is the health workers themselves. The CSWs or the CICs, OICs in those facilities are either competent or not competent to run the program itself, malaria program, or the knowledge in the specialty of dealing with malaria and the treatment in those particular facilities, health facilities in the province. So we need to strengthen the health workers themselves to be able to competently deal with malaria aside from other programs in the province. Another challenge we have is, we've talked about this already, some speakers have spoken about this, is in relation to community engagement. And community engagement reflects two things. First of all, the nets. When the nets are distributed to the locals, they are either using them or they are not using them at all for various reasons. And I think some of our speakers have spoken about the timing of when the mosquitoes at the point of biting, and people in the villages are normally, they move around and they don't go to sleep during those times. And whether or not they're in a mosquito nets or not, supervision is minimal. And so that's the community engagement part of it. It's a very important part of it that we are saying to the representative of RAM that we need to revisit the net distribution and whether or not the nets are effective. If they are not, we need to find solutions, so we strengthen the way we're doing it at the moment. And so that's about the nets. We little supervision on whether or not the people are actually using them. And if they're using them, they're not using them to sleep in, they're using them for fishing purposes or other purposes that they find useful to them. And so that's one of the challenges we have, particularly in monitoring and supervising whether or not communities, people are actually using these nets. The other part of community engagement is in relation to treatment. And treatment is like this. When they get sick and they come for treatment, they are given some kind of prescription and some medication to be able to go back and use to treat. But again, you know certain things about Malawan, and some kind of treatment is given to them, they go back and they don't continue to use those treatments or take those medications. They stop someplace and the parasite continues to carry on in them. It's hide somewhere and it carries on. So they will continue to get sick. And that's the treatment side of things. They do not normally go and complete the medications they take, or the prescribed medications a clinician tells them to take. The other is when they don't get the treatment, they use other means of medication or treatment to treat malaria. And one of the common ones is they just sleep by the fire and they think the heat of the fire will treat them and they forget the treatment completely. They don't use it. And so the parasite continues to grow, malaria continues to grow, and it's on the rise in the province at the moment. So those are the community engagement part of it. I think it's also like every other speakers have said, it's very important to us. We need to actually go and supervise and monitor whether or not nets are used properly or medication prescribed to them are actually taken and completed as prescribed. The other challenges we have are leadership and political will. In the province, we understand, just like every other provinces, there's a component of health funding through our leaders, through DSIP and PSIP. For us, this is either given to us or not given to us at all. So with our health function grants, earmark funding for programs, public health programs particularly, we continue to fall short. Because it's not only RAM going into the province to run this malaria program, but the PHA also has a responsibility. And so for us to also add value to RAM and the programs they run in the province, we need to have sufficient funding from PHA budget itself and also from our leaders, the provincial administration, to give us the DSIP and PSIP component of health funding. And that's 20%, that's a bit, quite a fair bit of money. But normally we don't get it. They decide whether or not they give it to us. So that's one of our challenges in relation to running the malaria program through the PHA, aside from RAM and the funding through RAM coming into the province to do that. Another challenge we have is we also require NGOs to do more supervision and monitoring. If this is going to be a program supervised by NGOs, supervision and monitoring is very important. And maybe I'm talking too much. Last, Manus is a maritime province, and part of our funding, a lot of funding is spent on fuel. We need to go to all the outer islands and visit all the places that we need to go to.
Thank you. Thank you, Mr. Posey. And everything that you were saying was absolutely worth hearing. So I think the main concern is that then just managing the time. So I'm to the esteemed CEOs, I'm just going to combine the last part here. And I think I can just turn to whomever wants to speak rather than going through, since we're running a bit short on time. So we went through a fair number of challenges, a few things that came forward as potential alternatives to improve delivery, but I wanted to go a little bit more into successes, best practices, or things, be they in, well, ideally in malaria, so we could start there. For example, we know that since 2020, home-based management of malaria has had volunteers and there has been success. But what is the path forward, either with a program like that or other programs, ideally again in malaria, but if they're outside of malaria, but you think that they could be applied to malaria, what might they be? That's the first question. And the second part of that is, how can we better share that? Is sharing that valuable between your provinces? So I don't know if anyone wants to take that up. Home management of malaria, volunteers. Does it make sense to have volunteers? Should they be paid? Should they not be paid? What's your view of that program? Are there other domains? Dr. Mamadi.
I can start, and hopefully I won't talk too much. Yeah, in Milne, we have that experience of HMM. We have volunteers there. And the beauty about that is accessibility. Service is closer to the people, and the people can access the service more closer. And so it is important that we encourage that. And I think WHO is also supporting the program here in the country, and hopefully that can take off. And I think it's also in the National Health Plan to progress the village health assistance. And I think it's important that that is progressed. And for us in Milne, we have seen it. We have started in a lot of districts. We are moving across to Samarai Murua and Kirina good enough, and hopefully we can try to cover the whole province. But these people are volunteers. Okay, they volunteer their time to serve the people. Okay, how many of us in this room can volunteer our time to serve the people, and yet we do not have to worry about our own needs? So it is important that we look at them equally, and that we should not use resources as a reason not to support these people, look after their welfare, because government is looking after our welfare. And there are countries in Africa and probably in Asia as well, where the government looks after these people because they deliver service direct. We support service delivery, but we don't deliver the service direct. So I think it is important that we seriously look at that, and the resources are available. We just have to manage them and direct them so that we support these people. So it is important that we do that. In terms of supportive systems, partnership is very, very important. Vertical partnership and horizontal partnership. And I think for us, vertical partnership, we are really doing that well. We are doing a lot of meetings, we are doing a lot of advocacies, but how much of that is translating? And horizontal partnership is very important with our political leaders at the provincial, district, local level, and at the ward level, together with various partners or communities that are at that level. So horizontal partnership is very, very important. The other thing too is advocacy. It is important to continue to advocate. Many people want to help, but when they look at the resource channeling, they're not able to see that resource translate. But if we continue to advocate, probably we can be able to attract more resources. And the other thing that I want to talk about is empowerment of people. We need to empower not only through knowledge and skill, but through resource empowerment as well. Many times we hold the resources back, but we deliver the knowledge and skill. It is important that the delegation go with the resources. And we allow them to manage the resource and deliver the service. And we just support from what you call a back office. So I think it is important that we do that. And prioritizing. One thing I observe is that we prioritize service delivery more, and human resource management becomes a second priority. I think we are getting it wrong. I think we should prioritize human resource management more. We look after people, and then they can deliver the service. I think if we can do some of those things, I think we can manage malaria and we can eliminate it. Thank you.
Thank you, Dr. Mamadi. Dr. Binga?
So thank you. I think a lot of things has been said. I think for PNG, the big thing for us that take out and perhaps we can already, and we are doing and can improve on, is the net distribution, and we do it well. I think that's something that we are doing, and we can do it well and start to bring our incidences down. If we do it well, let's not, kill ourselves too much. After the rollout of the mosquito nets, we have incidents of malaria, but a lot of severe malarias have slowly kind of come down. That was from the previous experience that we had. And so, apart from, from that, we know that there's a simple cases of malaria there, they're still there, but the severe cases are now coming down. That's a good sign, isn't it? And so the next thing we need to do is we continue to improve it and start addressing the simple ones, and eventually we'll move towards eradication. And I think from where we are sitting, the Department of Health has a very good program. It's called the Healthy Island Concept. Community engagement, one of it is the Healthy Island Concept. The Healthy Island Concept is a very good concept. I think it has worked well in one or two of our villages in Morobe. It's not only for malaria, but it's a total community approach. The cleanliness of the environment within that community. So when you do that, it's not only addressing malaria, but you're addressing a lot of things. And nutrition being also part of that. So approaching it holistically from the PHA side, we will be really putting a lot of emphasis on the, we'd like to call it from Morobe, not only healthy island, healthy village, but healthy world concept moving. Thank you.
Sorry. Thank you, Dr. Binga. Any further comments from Oro, Madang, or Manu CEOs? Yes, Mr. Posi.
Yeah, thank you. I think also in support to my colleague CEOs from Morobe and Milne, I think we have to identify whether or not the nets are actually working. And if the nets are not working, then we must find other alternatives. What is the solution? And for us, we are encouraging people to do research. Do some research to find out, again, whether or not there are other mosquitoes, those that carry the parasite, have evolved and come in existence. So we find the solutions to, if the nets are not working, then we are interested in finding the real reasons why the malaria is on the rise and find the solutions to them. Thank you.
Thank you, Mr. Posi.
To conclude from Oro, I think I alluded earlier, the first and foremost, we need to strengthen our health system. If we can have a vibrant and very strong health system moving forward, it will do a lot of justice to a lot of our initiatives, including the initiative to eliminate malaria by 2030. That's the first point. Secondly, to have a very good support from our leaders. From Oro, we have a very good leadership, and I'm honored to have the governor in our midst. Let me acknowledge him for his support to the health sector. If we can have a very good, strong leadership support, I think we can go a long way in addressing a lot of issues that are outside the health space, where you find that it contributes a lot to not only addressing malaria, but other health issues as well. And of course, we know very well that in health, we cannot do it alone. We need our partners' support. And in Oro, I'm glad to say we have a very good number of partners who are also very active and helping to really address a lot of health issues. And I think one area that they've come in a big way is the home management of malaria. And so far, within the 3 years, there have been quite a number of training that has gone. And I think that the initiative of VHV or VHAs, that's a very good initiative as well. We can also use that to roll out a lot of our malaria programs moving forward. Thank you.
Thank you. So, Mr. Waima, you can have the last word from Madang.
Yes, please.
Yes.
Thank you, Dr. Tas, once again. I think to strengthen the partnership is very, very important for us because of the level of funding that is going to the provinces for service delivery. Province, we have the PSIP, which contains a certain component of the health funding, and then we have the DSIP and then LLG-SIP. So if we can tie down or strengthen the governance framework in terms of service delivery, especially delivery of developing the service level agreements between NDOH, Department of Health, Ministry of Health, with the provinces, and then further trigger down to the district and the LG. I would rather see that will pave the way forward for us to actually enable the PHAs to deliver, and the province together, we can deliver we can achieve the target elimination by the period of time. And it also goes back to strengthening the health system and give a result back in measuring our national health plan. So I think it is more to do with strengthening the health system would be and then the governance part of it through service level agreement will be the way forward for us as I see. Thank you.
Thank you. So thanks to all of you. And before I turn it back to the chair, there were many points that were brought up. I just wanted to summarize 3 ones in particular that stood out from all the wisdom that was shared here. The first is a part about the importance of coordination of partners, development partners, research institutions, others through the PHAs, and how vital that is. The second was some concerns that were raised about nets and interventions, and the last was some specific suggestions around how financing and the flow of funding could be improved. So thank you so much for sharing this time with us. And Chair, Secretary Liko, I turn it over to you.
Thank you all the panelists, and thank you the moderator. I think at this juncture, I'd like to have the privilege to invite our Governor, Honorable Gary Juffa, to come and say his piece on the leadership that we have and his great leadership also. Thank you.
Good afternoon. Friends of Papua New Guinea and Papua New Guineans. Firstly, I would like to acknowledge the custodians of the land on which we stand, the people of Central Province, the people of Motu Koitabu. If it were not for them, we wouldn't be here. So an acknowledgement to their hard work in being custodians of this part of Papua New Guinea. I'd like to welcome all our guests who have traveled into Papua New Guinea from various parts of the region, of the world. Welcome to Papua New Guinea. It's a very unique country we call home, land of 1,000 tribes, 830 languages, 7% of the world's biodiversity, and many other intriguing aspects that we are proud of. I'd like to thank the organizers who made the effort to organize this very important forum. And I thank the sponsors, and I also would like to acknowledge the work of friends of Papua New Guinea, such as Dr. Das and his wife, who have been contributing significantly to Papua New Guinea, and my dear friend, Lady Roslyn, who has spent most of her life here contributing so much to Papua New Guinea. We're very proud of you, very proud of you. At this juncture, I want to take my hat off to Dr. Lino, who is a true champion in terms of working tirelessly to basically get our health systems fixed and moving and functioning as it ought to. Dr. Lino is a very hardworking member of parliament. He's a great leader. I acknowledge that publicly. He's also a dear friend of mine. Some time ago, I was part of the Parliamentary or Public Accounts Committee, a committee of the Parliament of Papua New Guinea, and we carried out an inquiry into the National Department of Health and the systems of health and what could be done to improve. That was a few years ago, and we made some recommendations that are being implemented, but very slowly, unfortunately, and you can hear this with disappointment in the voice of Dr. Lino. We keep fighting, keep struggling to get this through, but it's a challenge, I can tell you, in the political environment of our nation. It's ironic that I'm here at this malaria forum. 2 days ago, I was diagnosed with malaria. I think it was a way of reminding me that I needed to be here. And it was also a very legitimate reason for me to explain to my fellow politicians that I needed to take time out to attend to a very important forum such as this. I acknowledge our health workers in Papua New Guinea. They work under very difficult circumstances. And they're so humble. They won't tell you the type of challenges they face. And I think this is also a challenge in itself, in that oftentimes decision makers don't hear the real truth about what the situation is on the ground, you know, whereby we need to hear, say for instance, what I've heard here. We need to hear this type of explicit, real stories about the state of health in Papua New Guinea, and for instance, how we are addressing malaria, what's needed. So I acknowledge my health workers, but I would like to encourage you to speak up, you know, dispense with our culture is a culture whereby, our tribal culture, whereby we respect our elders, we respect those in authority, to such a degree that what's our responsibility, we manage it, you know, without having to bring it to them. Well, I think we need to change this when it comes to issues like malaria. We need to hear, the decision makers need to hear how bad things really are, you know, and even if it's to the point where you're persistent and annoying or irritating, it doesn't matter. This is very important. You know, the business of government is to save lives. And this is where we should be putting as much of our focus and resources as can be. I'll give you a little bit of an example from what we're doing in my province, Oro province, which is about 25 minutes by plane from here. It's a small province, 22,000 square kilometers with 300,000 people. It's about the size of Israel. We like to call it the land of milk and honey. Moses never made it there. You know. So I'm very fortunate to have a great team. And I commend Dr. Titus here, who we engaged through a transparent process. We went through a process of engagement that we felt was the way to go. We engaged a HR company, they advertised, they streamlined the applicants, and they got the best applicant. We then went through the same process to appoint a board chairman. So we have a very good board, we have a very good management in place, and they've got massive challenges. But having that in place gives us hope that we're moving in the right direction. And we are on a public forum where other citizens of my province, who are professionals, national agencies, private sector, we're all there together, and we highlight the issues that affect us, and we work together to address these issues. So I recommend that for provinces, to have that side of sort of a platform so that you can work, corroborate, cooperate. And you'll find that by doing so, you will see progress. For instance, Dr. Titus will not hesitate to post on our forum, I have drunks harassing my staff. And the provincial police commander will see that, or one of my provincial executive council presidents will see that, and someone will respond. Either they will get in touch with the police, or they will physically go there to see what's happening and work on addressing that situation, you know. And that's what you need to do in a country like Papua New Guinea, where we're very young. We're just 50 years old. So for many developing nations, I like to remind them that before you judge us, imagine your country 50 years old. If you were to take a time machine and travel back to wherever you come from, and it was just 50 years old, those challenges, that's what we're sort of facing. So, thank you, Dr. Titus, for the wonderful effort that you undertake there in our province. In regards to malaria, I mean, this scorecard here, I've just shared this with my colleagues on our government forum and said, look, if you look at where Papua New Guinea is, we've got work to do, serious work to do. I mean, our funding here, if I'm incorrect, please correct me. 27%, that's atrocious. In a land that's supposedly extremely wealthy with natural resources. Dr. Lino will be doing our best to bring this to the attention of our colleagues, and we have to keep making that noise. I speak from the experience of having probably contracted every type of malaria in my country, growing up in rural Papua New Guinea. I remember as a child I'd walk 2 hours to my community school, and if you were sick, they'd send you to the aid post, and you'd walk there and they'd treat you with whatever they thought you had. And at one time I had malaria, the worst kind. I think it's where you were very, very sick. I can't remember the exact type, but it made me sick. And those experiences have helped shape me to think more about what we can do now, you know, so that we can eliminate malaria. And we've started to put together a team, because I'm one of the, I think, 5 provinces where malaria is very much prevalent in Papua New Guinea. And this team is working together to assist our PHA, connect with our NDOH, and the rest of the team out there that's determined to eliminate malaria, and see what we can do to eliminate malaria in our province, and then offer that effort to other provinces. It's not perfect, and I'm not a doctor or a scientist, but I will try my best in my capacity as an elected member of parliament. The Papua New Guinea introduced the provincial health systems, which I think are a great idea, but the mechanics have yet to be put in place in such a way that they're effective. The way to go is to have a good board, a good management team, and very good relationship with your leadership and with other agencies and development partners. I'd like to say that I feel there's too little done on awareness from what I hear here. We need to do more in terms of educating our people about what malaria is about and how dangerous it is and what they need to know, how they can live in a healthy way so that they can prevent contracting malaria, what they can do about the environment. It's an interesting piece of information here about global boiling. I'm quoting the Secretary General of the United Nations, who coined this phrase, you know, taking it to a more serious state than global warming. Warming's a very nice, comfortable, you know, warm person, warm smiles. But boiling is quite frightening, you know, and it tells you how serious things are really in this world. And now that the world is boiling and you're starting to see temperatures rise, and this information about, you know, I mean, how do mosquitoes know that, okay, it's hotter, so we got to bite 3-4 times more than, this is worrying, you know, it is. And that type of information needs to be presented to our people, packaged in radio programs or on social media or other formats. And it's got to be consistent and continuous so that our people are able to prevent and be part of the eliminate malaria effort. And if we all do our part, all of us, in our various capacities, then we can eliminate malaria. Finally, I just wanted to make mention of a small conversation that I had with my good new friend from Solomon Islands. Thank you very much. And he spoke of an observation that I think is very important to note here. He said in countries, he referred to Solomon Islands, but it's the case here as well in Papua New Guinea, that malaria has become so normal that for us, it's almost like having a slight flu, you know? I mean, I've got malaria and I'm standing here talking to you. In Western countries, they would be referring me to the ICU, you know? But there are many people in Papua New Guinea who are moving around with malaria, and they're like, okay, I might have malaria, I'm going to take Panadol, or our favorite medication, amoxicillin. Self-treating is a thing here, you know. If you go to Manu, which is a small part of Papua New Guinea here, Port Moresby, a little suburb there, and here, Dr. Liko, I'd like to have your team, please take a look at this. We have the illegal sale of drugs on the street. And you go to a market, and the children, about 10 years old, will come with bags of medicine. And they'll diagnose you. They'll say, what's wrong with you? You know, you have a fever? Well, you need to take this. You know, they're making money, but that's what they're doing. You know, that's a worry. That's a worry. Now, if we do awareness, if we package this information about all of what we're talking about here in such a way that everyone can understand this and do something, then I think we'll be certainly moving towards eliminating malaria in Papua New Guinea. thank you very much for having me. I have another engagement, so I'm going to take 2 Panadine Forts and rush off to that. And I do appreciate the efforts undertaken by all of you here. And I really would like to give a huge shout out to our health workers who are the true champions of this country, who are tirelessly working out there in the most remotest parts of Papua New Guinea to ensure that our people have decent health care. Thank you very much.
Thank you, everybody. I think it's been a long day. I'm not going to delay this any further, but just to add the clarity before we close, obviously all our 6 speakers in the panel have spoken. We have, just for benefit of our overseas guests and visitors, we have in Papua New Guinea, the terrain, geography is very difficult. The 30% of what the government services can give is in health. The 70% are within other government services. That's being the socio-economic determinants, roads, law and order, schools, and you name it. So that's the challenge that we face every day to deliver the health services that's required of us. As you heard from our CEOs, those on the ground, those on the delivery systems, from the national government level, from the health department as a national level, to 21 PHAs, including Autonomous Region of Bougainville, and the faith organizations, Christian Health Services, and the Church Health Services. They deliver most of our services into the remote and rural areas of our country. We have the enabling mechanisms to start with the National Health Plan, that overarching, and that's the responsibility of the health department from the national level. And of course, our 26 agencies of health deliver those through the platforms of National Health Plan, overarching objectives and strategies in the National Health Plan. The current National Health Plan we have, it's 2021, 2030, have the Volume 1A, which is overarching. I think the 5 key result areas, that's basically from community involvement, that's key result area 1, and the key result area 2 being the partnership which has been elaborated and discussed here, to key result area 5 being the strengthening of the systems, from workforce to facilities, to investigations, diagnosis. So that now carries the subscriptions of how we want to see the health services delivered in our country. We also have the enabling legislations. So thank our minister, the leadership, that we have the amendment, and Governor also spoken, supports our minister. We have the amendments. We have the National Health Administration Act, which is overarching, that gives us the mandate of providing the health service in the country. Then we have the PHAs that from 2007. And we have the amendments basically to improve on the governance on the delivery system. So our CEOs who are the engine rooms of implementing those national plans, what the enabling platforms have they spoken. But they're as part of the KPIs. In our amendments of the 2023 PHAs, it now subscribes into what they can deliver in the indicators that we have in health. So just to give the clarity. So most of them have spoken. It will all take into consideration. Now we've also completed, apart from the National Health Plan 2021-2030, we've got our corporate plan, that 2023-2026, and it will mirror image in what all of them are saying into their corporate plans. And that also will then cascade into Volume 1B of our national plan, which is the intervention component that you've heard from Dr. Mamadi, talking about the chart of accounts. Our central agencies, Treasury and Finance, they control the IFMS, Integrated Finance Management System. So all of that discussed will be taken into consideration in our the resolutions going forward to support what we've discussed here in malaria and funding, and that supports the program and follows the functions will be all taken into account. But with that, thank you very much, everybody. And the objectives that we have with this, our leadership that we have, basically to also, as part of the commitment, the objectives are the effective implementations of national strategies at the provincial levels, the strengthened collaborations between the provincial leadership, fostering knowledge, exchange, and best practice for malaria control and elimination strategies. And finally, but not the least, endorse the PNG governors ending malaria, we put as JAM, governors ending malaria coalition outlining commitments to drive malaria control and the elimination efforts. So do we have that for the signing? We're expecting 5 or 6 of our governors to do the sign, but we can do the signing later, but just to make an announcement that this is an effort going forward. Thank you very much. Yeah. God bless.
Thank you so much, Secretary Liko. Thank you to our panel members. Dr. Das, thank you so much for moderating this afternoon session. I think we've learnt a lot, and we just also want to acknowledge Governor Juffa for your presentation, your support and your advocacy.